Hi everyone, and welcome to this video that's going to be focusing on our topic area for term 3 being community health. So let's take a little walk through and try and revise and remember what we've looked at so far. Remembering that community health is looking at two different aspects at the same time. We have our community. So a community is a collection of people living in the same place or having a particular characteristic in common. So you might have a workplace community, a school community. You might have a cultural background of some sort that makes you feel connected to a particular group of people. Or you might have a sporting organisation that you are a member of, and to you, that is a sporting community of yours. And don't forget, we have our health, which is essentially our mental, social and physical condition. So what does community health actually look like? It could be these people playing lawn bowls, but let's have a look at it in a bit more detail. It can mean different things for different people within a community. For example, we have our walking groups, and they might see participating in this as a way to stay connected with others, to keep moving, to be able to feel good, and to be able to socialise. We also have sporting clubs within our communities, and they provide us an opportunity to connect with mates, to have a sense of belonging, to enjoy competition, and to be pushed on improving our fitness or a particular skill set. To ensure good health, eat lightly, breathe deeply, live moderately, cultivate cheerfulness, and maintain an interest in life. Okay, health issues. Now these can be a mixture of our social, emotional and physical. They can be linked to either a community, a small group within the community, or the whole community as a whole. While a health issue can be a minor inconvenience for one group, it can be a life-threatening for another group. And I can think of many examples. For example, urinary tract infections might be something that young healthy people are able to just brush off as a minor inconvenience, but for people in the elderly age groups, it's a major medical condition for them to be dealing with. Location of services can also have an influence on our community health. If you have to travel very far to access a hospital, that can be a concern. And also the location of places like waste dumps, if they're near where people are living, can have an influence on our community's health. Health facilities are anything that has a focus on improving someone's health, whether it be their social, their emotional, or their physical health. And these can include all of these things, including gyms, fitness centres, senior citizens hall, yoga or meditation clubs, sporting clubs of any sort, local health services such as counselling, your doctor or general practitioner, physiotherapists, podiatrists, osteopath, dietitians, all of those count, as well as hospitals. And speaking of hospitals, when we look at things such as large communities versus small communities, there's a concern about access to key services. For example, where are you more likely to find a hospital? A city, a large country town, or a rural area? This is all to do with funding and can be sometimes a bit of a concern in regards to community health. And this is our little video based around community health. Hope this helps with your revision.